Hey, what's up everyone? Welcome to Careers Out There. I'm your host Mark Luber and we're helping you find a career that fits. Today we're talking to Sarah Vozen. She's a licensed acupuncturist and massage therapist, amongst other things. She's going to talk to us about careers as a holistic health practitioner. You're watching a short version of the interview with Sarah. If you want to learn more about being a holistic health practitioner, you can see the full interview at careersoutthere.com. Now you're going to see we had some Skype issues, some technical issues on this day. So it kind of looks like a kung fu movie where Sarah's lips aren't really moving but the words keep coming out, but it's just as informative. All right, let's meet Sarah. Can you explain for us the main difference between Chinese medicine and Western medicine?
I would say that the main difference between Chinese medicine and Western medicine is that Chinese medicine really steps back and looks at the whole picture and looks at the whole body holistically. So we're very much interested in how all of the systems of the body are working together, and if one is out of sync with the others, we understand why and how to put everything back together and get them working synergistically. Whereas Western medicine, often they look deeper and deeper and look at smaller and smaller pieces and often forget to step back and take a look at the whole body.
So how does that happen? Tell us what you actually do as a practitioner of holistic medicine.
So in the course of a treatment, when somebody comes to me with some specific symptoms that they're experiencing that they don't want to experience anymore, I acquire information not only about those symptoms, but also about all of their systems in their body. So if somebody's coming to me because they're having trouble sleeping, I don't just talk to them about their sleep. I also talk to them about their energy, their digestion, their other systems, the urinary, bowel, everything. So I want to look at how your whole body's working and how those other systems are affecting your sleep. And then once I decide what the diagnosis is for you, then we choose what tools, what methods of treatment are best for your condition. So perhaps acupuncture would be better. Sometimes herbs and supplements are better. Sometimes we focus on nutrition. Sometimes it's more about changing your lifestyle. And more often than not, it's really all of those things that end up to be useful. But certain conditions are more suited for different tools. So, we would give you a treatment and send you on your way, send you home with some homework or some herbs or some different things to work with in your lifestyle that complement the treatment. And then from there, usually you have a course of treatments, say 6 or 10 treatments, and then a reevaluation, a re-diagnosis, and then decide from there where we go. More often than not, people are coming with symptoms that they've had for quite a while or have been in development over a course of time. And in those cases, it takes longer to treat and help and get your body back in balance. So depending on what we're treating, different lengths of treatment are necessary.
Walk us through then a typical day. What's a typical day in the life of a holistic health practitioner?
I have clinic hours from 9 a.m. to 3 p.m. So, I get myself ready and I go to my clinic and I set up my room, which means I've got a massage table set up and I use sheets to cover them up. I set up my needles. I've got alcohol to sterilize. I've got different massage oils. I've got a biohazard container to make sure I put the needles away and in proper disposal. So once I'm set up, I see patients usually in 1 hour or 90-minute time slots are most common, I would say, for acupuncture and or massage. And in that time, I'll see 5 or 6 people in a day most often. As a part of my day, I often do some kind of physical practice that allows me to feel good so that my chi and my body is functioning in a balanced way so that while I'm facilitating a treatment, I don't get in the way of their healing.
And what's the most fun or rewarding part of what you do?
I think the most fun and rewarding part of what I do is really seeing the effect that my work has on people I mean, for the most part, I'm helping people get out of pain or, you know, reduce or relieve symptoms that are really getting in the way of their life. So when they leave from seeing me, they more often than not have a smile on their face and they're just more relaxed in general. And that warms my heart.
Hey everyone, if you want to learn more about being an acupuncturist and a holistic health practitioner, you can see the full interview at careersouthere.com, where we help you find a career that fits. I'm Mark Luber. Thanks again for watching, and we look forward to seeing you there.